Hello everyone, and welcome back to my show. I'm Dr. Locke from Acupuncture is My Life, and this is episode 2 of Acupuncture, the Coronavirus, and Hypertension. Now in this episode, before I get into pattern identification from a Chinese medicine perspective, I want to briefly touch on a particular concern from some members of my audience. Now there appears to be some concern that blood pressure medication increases a person's risk of contracting the coronavirus. Now, I'll start out by saying there is not enough evidence to support such a theory at this time. I can understand the concern because ACE inhibitors and angiotensin receptor blockers increase the amount of ACE2 receptors in the lungs, which are used by this virus as a passageway into human cells within the body. Now, although there is not enough evidence at the present to support this, I will say theoretically the possibility does exist based on an increased amount of receptors in the lungs, leading to a greater extent of lung injury. Now, I also have to state that there are some studies that indicate blood pressure medications may intercept and prevent the virus from entering the cells, which could protect the lungs from extensive damage. Now, COVID-19 patients who are hypertensive have been found to have increased levels of angiotensin II, which actually raises blood pressure, which leads to damage in multiple organs. I will state again, if you have not seen my episode on acupuncture, the coronavirus, and multiple organs, please take a moment and go back and watch it. But the jury is still out on whether blood pressure drugs hurt or help when it comes to being infected by this virus. Now, let's get back to looking at how an acupuncturist may diagnose a hypertensive patient. Now, some of the basic patterns of diagnosis would include liver fire excess, yin deficiency with hyperactive yang, liver and kidney yin deficiency, and deficiency of both yin and yang, and damp turbidity obstruction. Now, in Chinese medicine, hypertensive patients usually present with excess patterns, which eventually over time evolves into deficient ones. Now, in the more latter stages, a patient can present with both excess and deficiency. Now, chronic liver fire patterns tend to consume yin, which eventually causes yang deficiency. Symptoms of liver fire would be irritability with a tendency toward outbursts of anger. There would also be potential for tinnitus, deafness, dizziness, red eyes, and temporal headache. Liver fire also tends to dry up body fluids, which eventually results in constipation and dark yellow urine. Now, if you find you're experiencing these symptoms, contact an acupuncturist and request a consultation, as well as keeping your primary care physician informed as to what's going on as well. Now, preceding yang deficiency, a patient can usually does present with hyperactive yang as a result of liver and kidney yin deficiency. Now, from a treatment principle perspective, a hypertensive patient usually presents with hyperactive liver yang and liver and kidney yin deficiency. So when I design my treatment protocol, I tend to focus on pacifying the liver to gain control of yang, as well as nourishing the kidney and liver. Now, the angle of focus toward the liver in my treatment protocol would be to extinguish internal wind and transform phlegm. Once I've subdued liver wind, as well as having transformed phlegm, I would begin then to nourish yin of both the liver and the kidney. One of the primary channels affected from a Chinese medicine standpoint is, of course, the liver channel. As a refresher, when you get a moment, go back and watch my episode on the functions of the liver in Chinese medicine. If you've already seen that episode, you'd remember that in Chinese medicine, the liver has a lot of important functions such as storing blood, ensuring the smooth flow of qi, which is essential to all physiological functions in every organ, and controlling the sinews. Now, in the case of the sinews, the state of liver blood is extremely important with regard to physical activity, of course. Now, the liver also manifests in the nails. So if you ever notice that your nails appear like nails don't or should not normally appear, Visit an acupuncturist to inquire as to why. Also, the liver opens into the eyes, whereas blurred vision can be a sign of a liver pattern. The liver also is affected by anger, whereas chronic irritability can negatively impact the functions of the liver. Now, in my next episode, I will go into detail as to how to treat each pattern as discussed. Now, don't forget to subscribe to my show to learn more about acupuncture and Chinese medicine. And until next time, acupuncture is my life. What's yours?